periodic paralysis, sudden limping, or sudden sort of the paralyzed and thus unable to walk, even move, even four limbs unable to move for usually in weekly interval, and then may start in the neonatal period, and usually the symptoms are florid by 10 years or so. So these children has a little bit tricky different diagnosis. It's a genetic disorder with autosomal dominant mode of inheritance, and then they have the potassium channel defective, KIR21 channel is defective. Thereby you have good amount of time hypokalemia. Very rarely you can have hyperkalemia also. So this symptom, muscle weakness and others, but they do not have involvement of the respiratory muscles like diaphragm and and then your extraocular muscles and your cardiac muscles. Thereby these muscles involving functions like sleep and eye movement, the heart and respiration, it remains all right. So there is no fatality, but really there is one fatal conditions where there is ventricular tachycardia. It's been described the defect of the KIR21 channel, and at times it is confused with the thyrotoxicosis, and myotonia congenita. So they are to be excluded clinically and if necessary by muscle biopsy. So rarely this symptom are precipitated by the carbohydrate meal, insulin, stress, and your hyperaldosteronism. So diagnosis of this condition is super key. The muscle creatinine phosphokinase, muscle enzyme elevation in good amount of cases. Muscle biopsy is not mandatory, but if you do, you will find bacular myopathy. Treatment is certainly in hypokalemia, the potassium supplementation orally most of the time, and you're in the at times you have hyponatremia, so you can use the acetazolamide over here, and the FDA has approval for it, and your fluid intake, fruit juice mostly can ameliorate hypokalemia.